Ladies and gentlemen, dear colleagues, dear friends, due to the special situation, we would like to give you on this way an update and our preliminary statistic results for 2020. As we usually did in June, we would like to send it to you by sending out a link. So just briefly from my side, the update of 2020. Of course, as everyone of us, the impact of COVID-19 on organ donation and transplantation was really major. It was quite a new situation. We had temporary shutdowns of donation programs in the PLDO. Some DBD programs were stopped completely, Fribourg, Neuchâtel, Sion, Lugano, and also partially DCD donation was stopped in the whole PLDO, but also in the Inselspital of Bern. This had a tremendous impact on the number of donors and on the availability of organs. Also, unfortunately, transplantation programs have been affected mainly in the French-speaking part. We had temporary shutdown of deceased kidney and pancreas transplantation in whole Switzerland during the first wave. Fortunately, during the second wave, all transplantation programs remained open, with the exception of living donation, which will start again mid of February. So we really experienced a very close collaboration on a national and an international level. We organized a daily update, a case-to-case evaluation by the medical advisor of Swisstransplant, and we also involved our European partners with a weekly update. We had also large involvement of some colleagues between us, of some presidents of the expert groups, mainly Cedric Hirzel as president of the STAI, the infectiological group, but also of Professor Filip Dudkowski, president of the STAL, the liver groups. We had several exchanges and we were really under pressure to improve and to review our system in order to give access to transplantation to the patient on our waiting list. We had also some important significant logistic issues which were perfectly addressed by Alpinair Ambulance, our logistic partner, closed borders, COVID areas in hospitals, foreign hospitals, really a large task to solve, which has been perfectly solved by our logistic partner. All this modality have been published just recently, end of the year, in the Swiss Medical Weekly 2020. You see on the lower part of the slide the situation on March, with closed DCD programs on the left side in red, closed DBD programs on the right side in red, and open programs in green. You see, as we all know, that we had a tremendous impact, mainly in the French and Italian-speaking part during the first wave. So what was the effect on organ donation? We had the close European collaboration, which really solved our problems between March and May. You see in the upper figure, you see the imported organs in those 3 months, and you see that outside of urgent livers being imported from France, we imported several organs. Only 13 organs have been imported from our European partner, and these were mainly vital organs, which really helped us to solve the mortality rate on the waiting list, mainly in lungs and heart recipients. On the other hand, we had the shutdown of the national program in pancreas and kidney transplantation, and you see that also Switzerland shared their kidneys with our European partners. So between February and April, 5 kidneys have been exported. So what about the number of donors? You have the graphics here from January to December. The dotted line is the number of donors per month in 2019. And you see that we had an important peak in February in 2019, which we could not achieved in 2020. But on the other hand, donor numbers remained quite stable over the year, which is the fact that we had only a slight decrease of the donors with 11 donors less, which accounts 7% decrease in donation activity. So just briefly, the 2 expert groups, the Comité National d'Organes, which with its president, Dr. Matthias Nebiker, they did a lot by achieving the aim of a national standardization of a DCD donation protocol. A large work has been done by the revision of the Swiss donation pathway. We had a national standardization and an implementation of a consent form, which also focus on research issues which have to be clarified furthermore, and also new opening of DCD programs in Sion and in Lucerne. Unfortunately, they have been postponed due to Corona. We have a relaunch of establishing minimal national standards in cornea donation. In fact, the situation all over Europe led to an important decrease in donation activity in tissues. So actually we are running out of corneas, which really make it mandatory that we move forward and we try to improve detection of cornea donors and to procure those corneas whenever possible to cover the need of our recipients within Switzerland. We had a tremendous subsidiary involvement on ICU by Fox and also members from Swisstransplant during the first and the second wave. We were fully aware that the tasks on the ICU were very demanding, and we were more than happy with the support of the health insurances and the cantons that we were allowed to provide more personal resources, more experienced resources to the ICUs, which really did an amazing task during last year and still are working very hard in the context of COVID. We had a very high commitment of the CNDO, of the intensivists. We have reopening of donor programs which are closed due to COVID only for the circumstances that a donor has been detected. Many of those programs are kept open. Also today, most of the programs, nearly every program is open in donor detection. And what we realized that we had a tremendous solidarity with many donor evaluations announced to Swisstransplant during 2020, which allowed us to move forward and to keep the system as stable as possible. For the Comité Medical, with the President, Professor Dr. Markus Wilhelm, we did the second run of the KPD run. Unfortunately, due to COVID, it's still on hold. We have large discussion in context of the bylaws, mainly what should we do with an orphan donor. This is still not solved. We had a new modality which was implemented during the first wave, which is the so-called Swiss pandemic urgent status for livers. This allowed us to decrease the mortality in the initial phase of the COVID pandemic. However, we are fully aware that the mortality 2020 on the liver waiting list is really exploding. We had around 18 diseases in 2019, and for 2020 we were close to 40 diseases, so this number doubled, and this is really a very critical issue, which we also addressed with the Federal Office of Public Health, and we realized that we have to undergo a complete revision of the allocation algorithm for the liver group, which will be a tremendous task for this group. The Swiss donation pathway has been revised, as I just mentioned before. Mainly the procurement pathway was discussed within the STAPT. We had an evaluation of the ex vivo heart perfusion also in the context of DCD donation. And we are happy to announce that we had the first lung procurement in DCD donor with NRP in Geneva, which went perfectly well, and the results were outstanding. And a second DCD donor procurement has been done just recently. Also in the Comité Medical, I would like to thank you for the high commitment. It's not easy to guarantee those organ imports to travel to foreign country in this context with closed border. We had a large involvement at the level of the centers, trying to keep programs open and to give access to our patients on the national waiting list. So this was really a large task which has been fulfilled by you at the level of the centers, and I would like to thank you very much. I would like to show this picture. 2020 was a very cloudy, windy, very difficult year. We had a tremendous collaboration between ICUs, transplantation specialists in order to detect donors, to follow those next of skins, but also to guarantee best results in transplantation modality. Many of you as experts have been very much involved also on a national level, and I would like to thank you very much for this amazing task you did, all the results we achieved together, and hopefully 2021 will be better, and I am now handing over to Franziska Baylor for the preliminary statistics. I would like to thank you very much for your attention. Take care and stay negative.
Ladies and gentlemen, even though the STS meeting unfortunately cannot take place this year, I am pleased to be able to present the preliminary statistic 2020 to you in this way. As you heard already, there was a total of 146 deceased donors in 2020. In this difficult year regarding COVID pandemic, we have to observe a decrease of 7% overall in deceased donors, 4% in DBD and 12% in DCD donors. In living donors, the effect of the pandemic was even more negative. Only 83 living donors were registered, 79 kidney donors and 4 liver donors. Here you can see the evolution of the donation rate per million population from DBD, DCD and living donors over the last 5 years. Last year's in DBD we had 11.2 donors PMP and in DCD 5.8. Both together 17 donors PMP. In living donors, we had the lowest rate since 5 years with 9.6 donors PMP. Last year, the mean donor age decreased to 52 years. As well, the percentage of donors equal or older than 60 was lower and at the same level as in 2016. The youngest donor was 8 years old and the oldest one 86. The mean rate of transplanted organs per donor remained more or less stable. In DBD donors, 3.4 organs were transplanted, in DCD 2.1. Last year, we received a total of 294 organ offers from abroad, and 14.6% of them have been imported. 43 organs, 18 less than 2019, have been successfully transplanted. As in the last years, the majority of them were livers and originated from France. 13 organs have been exported, 2 hearts, 4 lungs, 1 liver and 5 kidneys. The kidneys were exported during the first lockdown when kidney transplantation programs have been stopped in the centers. At the end of 2020, 1,457 recipients have been registered on the national waiting list, 42 more than at the end of 2019. 50% were on a TCI status, and this percentage remained at the exactly same level as in 2019. 519 patients benefited from a transplantation from deceased or living donors. The decrease of 10.8% reflects, among other things, the stop of the kidney, living and deceased transplantation programs in the first wave, as Franz told you. 72 patients died in 2020 while waiting for an organ, which is 3.3% of the whole waiting list. Regarding the percentage of deceased patients per organ, the highest mortality rate is found in patients waiting for a liver. 39 patients, the highest number in the last 5 years, deceased in 2020 on the waiting list. So now let's have a closer look to the different waiting lists and the transplantations overall and per center. As you can see, the heart waiting list increased slightly. 144 patients have been on the waiting list during 2020. The transplantation rate increased about 15.4%. 45 hearts have been transplanted. In lungs, the waitlisted recipient increased about 15 patients And this was the highest number in the last 5 years. 106 patients were listed and 44 of them benefited from a transplantation. In liver transplantation, we can observe a decrease of 33 transplantations. 135 patients received a liver, nearly 20% less than last year. 39 of them were transplanted in an urgent status, 8 of them in the so-called pandemic urgent status. These are 10 urgent patients more than in 2019. A total of 425 patients were waiting for a liver. 4 livers originated from living donors, in which one was a domino donor. In kidneys, both waitlisted and transplanted recipients decreased again. 1,435 patients were registered in 2020, and 296 of them received a kidney from living or a deceased donor. In living donation, 79 patients benefited from a transplantation. One was an altruistic donor. Here you see the kidney transplantation rate per center over the last 5 years. For pancreas and islets, the waiting list decreased again with 70 patients. Also, the transplantation rate decreased slightly in comparison to 2019. 6 islets and 15 whole pancreas have been transplanted alone or in combination. And finally, with small bowel transplantation, there was 1 transplantation in 2020. At the end of 2020, 2 recipients have been waitlisted in a TCA status. If you would like to look at our statistic in more detail, you can visit our website. There you can find, as usually, our yearly statistics as well as our quarterly numbers. Thank you very much and stay healthy.